Hello, everybody. Welcome to the Conscious 2 pilot course and the introductory lesson of this course. My name is Jitka Rychlíčková, and I'm the leader of the entire project and of the pilot course as well. So welcome once again. The Conscious 2 course is very popular because we have almost 150 participants in here. So I'm very happy that we've got a very nice class, very nice size class in here. And thank you for your interest, for your participation, and for your time invested to this course. Today, the real goal of our session is to give you the orientation in the course, to give you the orientation in the entire Conscious 2 project, and also to introduce you to the interface of the training platform which is developed in this project. So let's start with the topic. At first, I would like to introduce you the Conscious 2 project. Conscious 2, as you might guess, is the abbreviation. The entire title of the course can be seen in the upper part of this introductory slide. And what is the main idea of this project is developing a curriculum on human clinical trials. So that also might be the main idea, the main expectation of you of this course. The Conscious 2 project is co-funded by Erasmus+, and it is a 3-year project, which is just becoming in the final year, so in the 3rd year. What are the project aims? As I said, it is about clinical trials and the topics related. So we want to develop a training program which will be focused on clinical trials from all perspectives. So from designing a clinical trial and planning a clinical trial. The next topic will be how to conduct a clinical trial and how to manage the clinical trial, and also how to work with the results, how to publish the results, and how to prepare the results in the appropriate format to present it to the wide spectrum of people. So this training program should be very complex. It should cover different topics around clinical trials. This program should be practice-based and practice-oriented. So this is our main aim in the project. Another aim is to implement innovative teaching approach, because as the investigators, so you might be involved in teaching. So these online classes may be inspiration for you how to prepare flipped classroom, and how to present your research to wide spectrum of students, and how to use electronic resources in the teaching. The third aim of the project is the interdisciplinarity. So we want to connect people from medicine, from pharmacy, from sciences, from healthcare, all together to discuss the topics of conducting, planning, designing clinical trials, and publishing the results. So the target population of this course are PhD students and early career researchers, mainly from the field of human medicine, pharmacy, biomedical disciplines, as I already mentioned. And why these people? That's the question. Because these people, so PhD students, might be potential initiators, at least initiators, but also investigators of clinical trials in some cases. Some of you may become members of the study teams or the project teams. So you might be at the site of the clinical site, or you can be involved in planning the trial, and you can be involved more in the project part of the clinical trial. And you, as PhD students or early career researchers, can have uh, the obligation to conduct a clinical trial in your curriculum. So that's why we aim at these populations. And because you might be in the future also teachers or lecturers, so that's the reason why we involved also the interdisciplinary part of the project and topics of teaching and innovative teaching methods. So the project, the Conscious2 project, has in total 4 project results. The first 2 project results are focused on developing training materials. The third is conducted right now, or it is starting right now, and will be conducted in next 3 months. And it is the pilot teaching. And what is important, the pilot teaching is not only about real-time education, it's not about only these sessions, but these sessions will be recorded. So you will have the opportunity to listen or to watch the video recordings later and use the video recordings as another study material. So the pilot teaching is the activity starting in January and ending in April 2024, and it will be conducted every Tuesday in the evening. So pilot teaching is the project result number 3, and the project result number 4 is the training platform. So it's an interface where the training materials will be placed. It's also the place where the pilot teaching recording will be placed, and where you can open them. And it's also the place where the interactive elements of the training materials will be in their active form. So you can find here quizzes, you can find here some practical exercises, and you can also find here some discussion boards where you can discuss some topics, specific topics with your colleagues, and that's the way how we support the interdisciplinarity. When I go back to the training materials, you can see that we have two types of the training materials. The first group of training materials will be focused on the life cycle of the trial, and you can see the topics. So the topics will cover maybe in the different order, but they will cover first 9 weeks of this course. And as I said previously, these topics are selected just to cover the practical aspects of conducting, planning, and managing clinical trials. The last 3 topics, so leadership, scientific publishing, and teaching the teachers, are topics prepared under the project result number 2, so interdisciplinary curriculum. And that's quite important, or these activities should develop your skills in the specific areas, also important for the potential investigators or initiators of clinical trials. So these 3 topics will be discussed in the last 3 weeks of this course. So let's say in the middle of March and in the beginning of April. So as I said, the order of the topics is a little bit different in this slide and in the plan of the entire course, but everything will be discussed in details. So please follow the instructions to be prepared for the appropriate topic. And this is the picture of our consortium. So the entire curriculum and the Conscious 2 project is solved in this group of people. There are also other people, but these people are the main persons who will be teaching you in this course, and also these people are responsible for developing the project results. So, for example, the training platform and so on. So the consortium of the Conscious 2 project consists of 6 full partners and 1 associated partner. And the first partner is Francis from University College Cork from Ireland. And if you are Francis in here, I would like to ask you to introduce yourself. So, Francis, can you hear us? Okay, so Francis is probably not in here for now. But Francis will be the teacher for the first lesson. So next week she will be discussing with you the clinical trial designs. And Francis has a very wide experience in clinical trials and the science around clinical trials. So she's very experienced in this area and in the clinical trial designs and the other topics which she prepared. She will give you many practical tips and practical knowledges. So maybe Francis will come later and will you tell more. Another project partner is University Nova of Lisbon, or in Portuguese, this official name. And from Portuguese, we have 5 colleagues involved in this project. It's Sarah, Joanna, and Emilia, and 2 people involved in the designing of the platform, which is Tiago and Marco. So maybe Joanna will be introducing University Nova of Lisbon.
Hi, everyone. So I'm here to present the team from Universidade Nova de Lisboa. So this is one of the youngest state universities from Lisbon. And we have Nova is a decentralized university with several faculties. In here, in this project, we are represented by 2 of the Nova faculties, the Nova Medical School and the Nova Information Management School. So we have several projects together, and we combine the experience in clinical research. The team from Nova Medical School that are me, Emilia, and Sarah. We have a lot of experience in clinical research, in teaching the clinical resource. We have a particular experience in the management of clinical resource teaching, and we take expertise from the team from the Nova Information Management School, Marco and Tiago, that they will explain their work here in the Conscious in a few moments, but they have a lot of experience in creating and developing learning research and learning e-learning masters. And in this, do you want me to present the lesson that we prepared for the?
You can do that very shortly.
Yeah. So we were responsible for the lesson number 3, the trial management, and we try in this lesson to give you an overview and the importance of the a structured and practical business-like approach in the trial management, and we put in this chapter the main important aspects of the managing the clinical trial, from the implementation phase to the end of the trial. And we also give some emphasis the importance of oversighting and monitoring the progress of the trial to ensure the right and the safety of the participants and guarantee the high quality of the data. That is one of the main objective in the clinical trials. We also try, because the Conscious II is very orientated for investigator-initiated clinical trials. In the lesson, we also try to give you some tools and free templates that you can use also to prepare your trial management plan or monitoring plan. And this is what we are going to present you in the lesson, trial management lesson in the pilot teaching. We are trying to use these tools to be a practical lesson. And
perfect, Joanna. Perfect. Thank you
so
for
Sara is also here, and Tiago. I can see Tiago also, but
Hello.
I think
Hello.
Hello, welcome. We will have a special session with Tiago, because Tiago is responsible, as we heard, for the platform. So we will see Tiago in several seconds with more details on his work. Okay, so Jonah, thank you for your introduction, and also for invitation to your lessons. It seems to be very fruitful. And I would like to ask another colleagues to introduce themselves, or specifically Victoria, to introduce University of Paris. So University of Paris Cité in the original name. So Victoria, the floor is yours.
Thank you, Jitka. I'm just waiting. Hopefully, am I visible?
Yes, you are visible. I can see the video. If you want to share your screen, I can stop sharing.
It's all good. So I'm visible and audible. So welcome everybody to this introductory course in our pilot teaching. I'm Victoria from Paris, representing Université Paris Cité, and our team, which is made up of myself and Professor Stéphane Mouly, who is an expert in pharmaceutical trials, and is also a doctor in internal medicine. As for myself, I work at the medical faculty here at the at Université Paris Cité, and I'm an expert in innovative teaching methods, critical appraisal of scientific articles, and communication, scientific communication in general, so reading and writing, and communication. And as you know, our university is responsible for the interdisciplinary chapters of our program. And now, before I move on to that, just a little bit of an introduction on our university. Our university is actually the biggest university in France, meaning that we have all of the faculties that exist in the world, and our medical faculty is certainly the largest in France. Now, as for what you are going to learn with us, so as I mentioned, we are responsible for the interdisciplinary chapters, meaning leadership, scientific publication, and teaching the teachers, training the trainers. Now, I can see, or I can see in the numbers of enrollment that you're a little bit puzzled by these chapters because they are different from the rest. So what I would like to tell you is that concerning the leadership chapter, the fact of the matter is the difference between a scientist and a scientist who does have a successful career is their leadership skills. So while it's pretty important to have a wide variety of knowledge, it's also important to have leadership skills. So I really invite you, even if you haven't signed up, to come to this class, because this is what's going to boost your career. Same goes for the one about scientific communication. Being a researcher and publishing is a good thing, but being a researcher who has impact comes down to your capacity to communicate to the scientific community, but also to wider audiences. So yet again, I invite you to come. And the last point, teaching. All through your careers, you will be made to teach, and you might think teaching is just preparing a PowerPoint. Now, the difference between a teacher whose students stay at home and sleep and a teacher whose classroom is filled with happy students who acquire skills is their capacity to plan and prepare skill-based innovative classes. So yet again, if you want to be a happy and successful teacher, please do come to our class. And I think that's it for me. You will be informed before the class what to do. You will have to read a little ahead of time and watch some videos, because in our classes, the idea is for you to act, to do things, because skills are about doing things, not about just memorizing things. The idea is for you to be able to write, to be able to communicate, to be able to teach, and to be able to lead and be part of a team. And that's that from me. Thank you, Jitka.
Thank you, Victoria, for your introduction and also for your plan. I'm pretty sure that the students who didn't originally selected your lessons are now on board. So that's perfect. And I think that the last three, or I'm pretty sure that the last three topics will be very valuable for anybody of us. Okay, so Victoria, thank you again. And I would like to ask Robert maybe to introduce University of Pécs, another partner of the Conscious 2 project. Robert, floor is yours.
Good evening to everyone. Jitka, may I ask you just to share the authorization with me, because I prepared a short presentation.
Okay, so I have stopped sharing. And
it seems that I can't open it right now. I can share with you, but generally I will try then to represent chapter 6, and before that University of Pécs, if you let me. So the thing is that I'm not the author of chapter 6, but I'm representing today University of Pécs team. Our team consists of several researchers. Among them are Robert Herceg, Professor Gabriel Kovacs, Zsófia, and Tamara Vég. And I just wanted to show you on the slide, because you can imagine easier where actually University of Pécs is located. It is located the south part in the country, approximately 250 kilometers from Budapest. And the university is established in 1367, which means that a few years ago we celebrated the anniversary of 650 years, which means that we have a very, very old and respectful university, not just here in Hungary, but in the whole region. According to that, we have very significant and impressive numbers regarding teaching staff, students. We have more than 20,000 students and 10 faculties and 22 doctoral schools. And I would like to highlight that most of the doctoral schools are available in English. So that is very impressive, I think. Just to summarize a little bit, actually, what is our role in this project? I mean, role of University of Pécs. Our task was chapter 6, which is data management. And I got a summary from my colleague, Robert Herceg, who is the author of the chapter 6. And I would like to summarize now what's going on in chapter 6, actually. So this chapter focuses on core principles and standards of research data management, as outlined by the FAIR principles and their global implementation. So data management encompasses a series of procedures involved in handling information during medical research. Its primary objective is to ensure the quality, integrity, and adherence to various protocols and regulations. It assists key stakeholders, such as sponsors, research organizations, and clinical centers, where data collection occurs in staying on track. I think it sounds pretty dry, but hopefully this will be more interesting when my colleague represents you the whole chapter. And during our session, he will try to open discussion about different kind of questions regarding this topic. But be sure data management is a very important part of Conscious2 project. So shortly, I just wanted to summarize our role in the project. And if you have any kind of questions, I encourage you to ask my colleague in February. So that's all for now from our side.
Okay, thank you, Robert, for a very nice introduction. And I must say that Peć is very nice place, very nice city. So if you want to visit not only Peć but also University of Peć, do not hesitate, because it's very valuable experience. Okay, I will just start sharing of my presentation. So hopefully you can see again my presentation. And for now, I would like to ask another partner, the representative of another partner, to introduce yourself. And the representative is Anna-Marie, and she's from University of Szeged again, Hungary. So Anna-Marie, can you please introduce yourself?
Hello, everyone. I'm Anna-Marie Németh, and I work at University of Szeged, Hungary, where I work in this project with my colleague Eva Takács, and we are responsible for 2 chapters of this curriculum. So you will meet us in 2 lessons. And the first one is early phase trials, which are the first step in the clinical with medicines when you plan clinical trials. So the early phase trials are just after animal tests. That's why they are really special, and I want to show you the practical side of how they are planned and how they are managed. And I hope that I can also invite a specialist to the lesson, and you will meet him and ask him questions about early phase trials as well. And our other chapter is about medical devices, how clinical trials with medical devices are planned and managed and conducted. And this is also a very important topic in clinical trials, since we usually talk about medicines when we talk about clinical trials, and most of the lessons here will be about medicine development, but this lesson, which will be around the end of the course, we'll focus on a different perspective. So how to plan clinical trials with medical devices, which is a completely different area and a different regulation on that topic. So I hope we will show you some new ideas that were not covered in previous chapters. So see you in 2 weeks' time. Thank you, Jitka.
Thank you, Anna-Marie, for a very nice invitation. I'm pretty sure that you will have many participants in both lessons, because this area, or at least the area of medical devices, is very live and very changing right now. So it's more than useful to participate. Okay, so thank you once again, and so. I will ask Lenka to introduce our university, the Masaryk University in Czech Republic. So Lenka, I will stop sharing you to be able to open your slides, and please tell us more about Masaryk University.
Okay, good afternoon, ladies and gentlemen. It's my great pleasure to represent Masaryk University. and introduce you the Faculty of Medicine, where I am with my colleagues based. Masaryk University is located in the Brno. It is the second largest city of the Czech Republic, and we love to say that we are in the heart of the Europe. Masaryk University was founded in 1990 by one of the first Czechoslovakian law, and it's called after our first democratic president, Tomáš Garrigue Masaryk. Masaryk University has 10 faculties, but let's focus on the Faculty of Medicine, where I'm based. We connect history, tradition, and quality of education. And since our establishment, we have educated over 22,000 doctors, 3,000 healthcare professionals, and 3,000 dentists. The education is primarily done in 16 theoretical institutes, and practical skills are trained in 48 clinics. Per year, Masaryk University has more than 4,000 students and around 1,500 employees. Our mission is to educate the new generation of the doctors, healthcare professionals, and share the best knowledge and skills, and actively participate in scientific research. We are part or coordinating various national and international projects, such as, for instance, Conscious 2 or CzechRin as well. And it's the reason why we are participating in this project. Thanks to the faculty and medical student education, we have a experience in teaching. But thanks to the large research infrastructure, CzechRin, we have expertise. CzechRin supports personalized patient-centric clinical research, and the vision is towards patient-oriented medicines. CzechRin support patient-oriented research and try to translate the results from these clinical trials to clinical practice to optimize and improve the healthcare, generally speaking. Same as Hungary, France, Ireland, and Portugal. We are a part of the ECRIN, European Clinical Research Infrastructure Network. And thanks to that, we have connections, and we have the opportunity to share our knowledge and expertise, and that's wonderful. CzechRin stands on the 4 main pillars: network, expertise, research and development, and education. CzechRin was established in the year 2014, so it means that this year we will celebrate the 10th anniversary, and we have supported more than 130 clinical trials, investigator-initiated clinical trials, and we are part in 68 international projects. Our expertise in this project is especially the pharmacovigilance and handling with investigational medicinal product. And if you want to learn more about us, so follow us on social media. And thank you for attention.
Thank you, Lenka, for introducing our university. And I will just summarize that we will give you the lessons on, as Lenka said, pharmacovigilance and study medication. One of our colleagues will be talking about regulatory aspects of clinical trials. So again, very lively area. And we will also talk about pediatric clinical trials, so something very specific. But again, we have several experiences with clinical trials in this area. So again, you should see my original presentation, and I would like just quickly introduce the 7th partner, ECRIN, a European Clinical Research Infrastructure Network, in here represented by Christine Kubiak, is our associated partner. So it's not a full partner, but we are very glad that ECRIN supports Conscious 2 project and Conscious 2 consortium by reviewing all the materials prepared. So all materials which are on the training platform are reviewed and controlled by people from ECRIN, which means people with wide and deep experience in clinical trials. Okay, so that was generally about the Conscious 2 project, and hopefully you can have now better idea what is it about and why this course is conducted right now. And I would like to ask Tiago to introduce the training platform to you. So all of you should have received the credentials to access the training platform. So for now, you will get more information how to use it. So I will stop sharing, and Tiago, you can share your presentation.
Hello to all of you. Hopefully you are seeing my presentation. Is that right?
Yes, we can see it.
Okay. All right. But okay. Just let me. All right. Good.
Now, yeah, it is better now because previously I could see only 50% of the slide.
Okay, so now I can see as full, right?
Yes, now is it correct?
Okay, perfect. Okay. So first of all, thank you for enrolling on our course. We managed to develop a learning platform that we learn to the experience that we had on the first project, on the first Conscious project, and we try to improve the previous build platform. So I prepared a short presentation that will walk you through most of the features that we have implemented, okay? So you received first email that I sent to all of you with your own credentials. And this is the landing page that you see once you log into the, once you search to the URL of conscious2.novams.unl.pt. So this is the landing page of the platform. You should use your credentials that I sent to you. Some of you struggled by using the provided credentials, and I sent another email to all of you asking if you are facing any issues. You should contact me that I will provide you a pair of new credentials that allow you to have access. If any of you of the participants on this session, if any of you didn't receive my email or still struggle to have access to the contents, please send me an email. I will share my email with all of you so that I could help you through it, okay? So once you log into the platform, you should, it is a nice policy to go to the upper right screen, side of the screen of the platform, and then you should update and edit your profile with your picture, with your contact. So it's more pleasant for the professors to know who they are interact with. If you log into the platform, and I noticed that some of you are already online, which is nice, by the way, you will check out that you have 9 available chapters so far. So far we have 8 full chapters ready to be consumed according to the pilot sessions schedule. And in the future, of course, we will have the other missing chapters as soon as we evolve during the sessions. Each of these pages or chapters, they share a common base, a common resource base, meaning that all of them contain a roadmap which contains the estimated duration of each chapter, so you know how much time it will consume of you to finish this chapter. You also have the pilot teaching Zoom link. It's already available under the under each chapter page. You have an introduction, then you have full access to contents and resources. You also have evaluation and participation activities such as quizzes and discussion boards. And finally, you also have a conclusion of the entire chapter and the chapter reference. So meaning that you have access to the full reference of the course. So now I will walk you through some of the common contents that I explained to you. So the first content is the first common content. It is the roadmap, which you contain the course guideline, as well as the total required time to finish this each chapter. For instance, you know that for chapter 8, you will need at least 2 hours and 15 minutes. So you have a breakdown of the time that you will spend on each and any of the chapters. To help you navigate throughout the contents, all the this platform was built with collapsible sections, meaning that you will find these arrows which you can click and to expand or collapse each and of any of the sections that you will find out. You will also find the pilot teaching Zoom link, which is already available. For instance, for chapter 8, which is January 30, you have here some of the generic instructions for the students. For instance, for this chapter, you shall review the entire lesson with emphasis on some of the contents, all right? And you, of course, you have the Zoom link and the assigned teacher for this pilot teaching content, okay? In a generic manner, on each and any section that you'll find for each chapter, you will find, of course, the content, right? You have textual context, you have pictures, you have tables, you have these yellow boxes, which I'll explain to you right away. And you also have some interactive resources, such as videos. You also, of course, have access to PDFs and some publications that could be interesting for this course. Sorry, I just skipped to the end. Okay. So as for the yellow boxes, they are additional information which they focus on any specific content. So mainly they are additional resources that could give you some light upon the mandatory resources that you should read, of course. So these are additional contents that you will find for each and any of the resources that you'll find out. And of course, you have quizzes that you can reply anytime you like, of course. So we have true, false, we have multiple choice, and you'll find some of the chapters, they have a final quiz, but most of the courses, they have a couple of quizzes that you can go and solve throughout your learning experience. You will also find some discussion boards that we wish you to give some nice discussions and some nice participation. And these are like evaluation or participation focused contents that we built into this platform. And of course, to each and any chapter, you will have the references, the full references that were used to build these resources. And of course, you have access to the full documents, which is also a nice feature. As for some housekeeping rules, and of course, to help you guide you through this course and to your learning experience throughout this project, if you encounter any technical issues, of course, you can send me an email. Of course, I'm not an expert on the published contents. Okay, so I will I'm not capable of helping you to know anything about clinical trials. However, I'm an expert in any learning platform, so I will be very happy to help you throughout your experience. So this is my email, tiago.oliveira@novanes.unl.pt. Under the subject, you should highlight the chapter names so it's easier for me to locate the chapter, okay? And when it comes to details, you need to describe what your experiences, and of course, you should provide me with the print screen or with the screenshot information, and of course your details, so I can locate your user and I can help you throughout the to help with your technical issue. And this is what I prepared to speak with you today. So looking forward to not to receive many complaints on technical issues, okay, but looking forward for your learning experience on our platform. So please enjoy. Jitke, anything that I could add to the discussion?
Tiago, I think everything was said and everything is quite clear. So hopefully anybody can now know how to log in, how to use the training platform. And as you said, if there are any technical issues, the students or the participants of this pilot course can contact you and ask you for help. And as Tiago mentioned, it is important to contact him only in relation to the technical issues. And if you have any questions to the content or to the organization, you can contact me, or you can contact the other representatives of the consortium. So all the people who presented today can be contacted. So Tiago, once again, thank you for a very nice introduction of the training platform. Thank you for all your work on the training platform. And for now, I would like to move to some general rules of the pilot course and give you some more information about the training materials. So I will start with the general instructions to these online sessions, and I would like to start with the name in the Zoom, because as you were informed previously, after finishing this course, you can obtain the certificate. And the certificate can be released only for those who have 7 out of 12 meetings or were present in 7 out of the 12 meetings, and we need to identify you. So I would like to ask you to use clearly identifiable name in Zoom, ideally your name, because if you have any other name, for example, a yellow rabbit, we will just release the certificate for this name, and this is probably not useful for you. So please use clearly identifiable name in these sessions. The next general instruction is do not share the Zoom link. You can see that we are here more than 150 participants, and as I said in the beginning, this course is very popular, so there were many participants who couldn't join because of the limited capacity and so on. So please do not share the Zoom link, because we have some limited capacities, technical capacities in here, and we would like also to make these classes interactive, so it's easier in this very nice size class. Another instruction is be on time, because in the upcoming meetings we will have some breakout rooms and activities, so it would be nice to start all together and everybody to be informed what to work on. Another instruction is for you, or another instruction is to be prepared. Because if you have read the pre-class reading and if you watch the videos and so on, you can ask more specific questions. You can use the course with higher efficacy. So all the discussions may be more focused and so on. So do the maximum for this course and prepare in advance as specified before each lesson. And the last instruction is be active in these sessions, because this course or these lessons are for you, and you will be sharing your questions, your problems, your opinions, and so on, and that might be helpful to other participants as well. So be active, ask questions, try to design some specific tasks and so on. So do the maximum, or do the maximum to get the maximum, I would say. And the last instruction is about the feedback. So at the very end of this course, we will send you the general questionnaire. What do you think about the course? What would you like? What you dislike, and so on. So we would like to ask you to give us specific feedback, and this is also important for us because of other upcoming projects, which can be more focused on your needs and on your ideas, what would help you more. So the questionnaire will be sent at the very beginning of the course after the last lesson. So please do not ignore. Please fill it in. And now, because as I said, we expect you will be active during these Zoom meetings, I would like to help you to get familiar with the Zoom, because some of you might not have a wide experience or deep experience with this software. So let's do some very easy exercises in Zoom. And the first exercise would be raising virtual hand. I don't want you to raise your hand. I would like you to raise your virtual hand. So if you don't know how to do that, it depends on the interface which you have, if you are on the cell phone or if you are on the computer. But you should see the button of reactions, and if you click on reactions, there is several pictures, several options, and one of them is raising hand. If you don't see reactions in the basic menu, you can see here 3 dots and the word more. And if you click on this option, you will open several options, other options, and in here there are reactions. So, and you can raise your hand in here. So I can see that around 80 participants already raised their hand. So probably it's very easy for you, and you can use this function, for example, when we vote for something. So if you agree or disagree or something like that, you can also indicate that you have a question this way. So during the lessons, you can raise your hand, and we will know that you want to ask a question or you want to tell your opinion. Okay, so you can just put down your hand, and we will do another exercise. So I would like to ask you to open chat and ask a question in here. So there is a button in the basic menu called chat. So if you open that, you should be able to type a message in here, and this message can be addressed to only some people or to all people. So just type a message, for example, where are you from, and or you can greet us, or you can write anything. So I can see that you are using chat, or most of you already used something, and there is also in another option of question and answers, but chat is more preferable option for us. So again, this function is for you. If you have any questions, just write them in here, and we will answer them in the end of the meeting, or we will answer it or the questions during the lesson. So it's very important for us to have the written question in here. We can prepare them then the answer. Okay, nice. So I can see that you are very active, and for now, let's try to switch on and off your microphones. So please switch your microphones only for 1 second, just to try. So the microphone is the option in the
Actually, I
basic
can
menu.
see I spotted someone else from Cork.
And please switch off
Or
your
like Dolan, to go
microphones.
breakthrough.
Hello.
Hello, switch.
To go breakthrough cancer research.
Yeah, so there that's the reason why we set the meeting for switched off microphones in the beginning, because in this number of participants there will be very strong background noise. So that's the reason why I would like to ask you to switch off your microphones for most time of the lesson. But if you have a question, or if you are asked by the lecturer to answer directly, you can use microphones this way. Or in the breakout rooms, you can switch on your microphones and discuss directly. Because in the breakout rooms, you will be working in small groups of let's say 10 people. So it will be very easy to discuss. Okay, so that was another functionality in Zoom, and now we will do the most complicated, let's say, and that's that's going to the breakout rooms. So we are now all in the main session, but in the upcoming lessons, sometimes you will be working in smaller groups in the breakout rooms. So we will in several seconds, we will open the option to go to the breakout rooms, and please accept the invitation, go to the breakout rooms and discuss here, for example, where are you from, or what is the weather at your country or at your place, and so on. So I would like to ask technical support to open the breakout rooms, and we will invite you back in several seconds. Okay, so welcome back. So hopefully you were successful to go to the breakout room and also to go back. And hopefully you have some opportunity to discuss where are you from with your colleagues. So that was the last training issue, and hopefully you can still see my presentation. And I would like to ask to tell you something more about learning modules, but Tiago mentioned most of the information, so it will be just repetition. So all the materials available are peer-reviewed, so the revision is made by ECRIN, our associated partner. I can hear some background noise, so I would like to ask you all to switch off your microphones, please. Nice, it seems better now. So all the learning materials are peer-reviewed, so you can be sure that they are up to date and that they are correct. The learning materials are available on the training platform, which was introduced by Tiago. If you prefer the printable version, you can find the printable version of all chapters already published on the training platform on the website, on the project website. In the end, I will show you the address. And in the results and curriculum lessons session or section of the websites, you will find PDF versions of the chapters. So you can print them and read them in another format than in the training platform. But in the training platform, the materials are updated more efficiently. So there might be some differences, and the training platform is the primary source of information and of the learning materials. As Tiago already mentioned, there are yellow boxes in the training platform and also in the printable version. And yellow boxes just describe some additional content, so you can see, you can find here some more specific information or practical information, some practical examples, many useful information. In the printable version, in the PDF version, you can find also blue boxes, which are not present in the training platform. Blue boxes describe the activities, so discussion boards, quizzes, for example, videos, and so on. So that's the reason why they are not present in the training platform, because there is the interactive elements. But in the printable version, you can find here blue boxes and, for example, email, website addresses, or some quizzes and so on. Discussion boards, there is just an information that there is a discussion board in the training platform. In the printable version, logically, there is no way of doing discussion board. And Tiago also mentioned time requirements. So, at the very beginning of each chapter, at the training platform and also at the printable version, you will find the time needed to study the general content, the activities, or the time needed to prepare the activities, and the total time. So it might be useful for you and give you better idea how much time will be required for preparing for a specific lesson. So for now, we should have discussed the first lesson, which is planned for the next week, so for January 16. And the topic will be clinical trial designs and the basic information. So how to get prepared for this lesson should have been presented by Frances from University College Cork. Unfortunately, she wrote me that she's in a meeting and she can't join right now. So I would like just to share information that that she will send you tomorrow. The Zoom link for the upcoming meeting for the first lesson, so for the next week, and she will also send you more instructions how to prepare for this lesson. So what to read and what to look at before the meeting. So that was about the next week, and for now there is a space for you to ask questions if you have some. You can use chat, so I can see here many messages, and I can see that in Brno is probably -9. So it's very cold outside today. But I don't see any new questions in here. You can also raise your hand. Yeah. How is the duration of each lecture? That's a very good question. There is the maximum of 90 minutes. So the goal is between 80 and 90 minutes. So we will start at 6 p.m. Central European time. So if you are from Portugal or Ireland, it will be 1 hour earlier. But the lesson should be for 1.5 hours approximately. So that's for the first question. I can see another question. Are there language requirements for working as a clinical trialist in EU states, such as Czech Republic? I would say that you need to understand English, and yeah, for the national language or the national issues, there might be some requirements to have to know and to understand the national language. For example, for Czech Republic to understand Czech, because some legislation, for example, is nationally specific. So not everything is translated to English, but English is basic. Okay. I can't see any other questions, but I will give you several. One more question in here. Very nice. Will we have access to this lecture recording? Yes, you will, but not directly after this this meeting, because we have to cut and we have to control that everything is okay in here. So we will be sharing these recordings, so recordings from all lessons, and we will be sharing them on the platform. So on the training platform, which was presented by Tiago. And when you have access, you will have access also to these recordings. Yeah, Tiago, thank you for sharing the link to the platform. And what will be the certificates certify if we qualify for it through attendance? Yeah, the certificates just confirm that you attended this course, and the names of the lessons will be specified, and the time requirements or the time spent by studying will be specified. And I'm not sure if any other information will be on the certificate. So I'm just looking at my colleague, and she confirms that the names of the lessons will be certificate and your name. And another question: for those of us who did initially not enroll ourselves for all chapters, is it possible to get a certificate? Yes, you need to participate in 7 out of 12, so more than 60%, I think. So if you participate in more than in at least seven lessons, you can get the certificate. And I can see another question. Will there be some online networking event for graduates who want to work in this field after the course? Will the certificate be valid qualification for such job positions? That's a very nice question, I would say. I will start with the second question. So will the certificate be a valid qualification for such a job position? The certificate just certifies or confirms that you attended this kind of course, and it depends on your employer, future employer, if it is enough for them. But your name and the content will be specified on the certificate. And according to the networking events, we have the plan to organize 3 multiplier events. So I will just move in my presentation to the last slide. And you can see that the multiple events for February in Lisbon, Portugal, in May in Paris, France, and in September in Brno, Czech Republic, are planned. We have the exact date for Lisbon's multiplier event. It will be on February 7th. And you can join. You can get familiar with the entire project, and you can meet with other participants in here, and you can also participate in other multiplier events, and that's a very good inspiration, your question is very good inspiration for us to organize such a meeting in Brno at the very end of the entire project. So if you would like to visit Brno, just consider participating in this multiplier event, or we can meet all together in Paris in May. We don't have exact date currently, but we have the exact date for the Lisbon's multiplier event, and as I said, February 7th. So in less than 1 month. Before I will answer the other questions in the chat, I will just show you one more information on clinical trials. So if you study the materials, and you will feel that you need some background information about clinical trials and so on, you can use the Conscious One project results. So the previous project which was conducted in years 2018 to 2021. And this project was focused on undergraduate students. So Conscious 2 is focused on postgraduate students, and Conscious One was designed for undergraduate students. And you can see that in this project we prepared 14 chapters on different basic topics around clinical trials. So, for example, why clinical trials are the gold standard. What is clinical research about, and why clinical trials are necessary for the clinical research. Then we have here chapter on ethics in clinical trials, a chapter on the informed consent and on protocol. There is also a chapter on pharmacovigilance and, for example, on trial management, but from the basic point of view. So if you would like to study some basic information, do not hesitate to copy this link, the link in the lower part of the slide, which will enable you to get to the Conscious One training platform, which is very similar to the Conscious 2 training platform, and you can open after registration all of these materials. They are already final, so you can use them for studying. So I will go back to the final slide and open again the chat. And there are already some answered information. So yeah, Joanna confirmed the multiplier event in Lisbon on February 7th. So I was correct. That's very nice. And printable versions, and Zora shared the link to the websites and the printable versions of the curriculum lessons. So as I said, primary source is the platform, but you can also use the secondary source. Yeah, there is a question if these materials will be equally applicable for a clinical trial set up in a pharmaceutical company, or it may be more applicable to academic clinical research. Yeah, these materials are prepared by the people working in investigator-initiated clinical trials. So we have more experiences with IIT trials. So I would say the materials will be more applicable to this area, but I must say that most of the information are applicable or are transferable between IIT and commercial clinical trials. If somebody else wants to comment, you can just switch on your microphone. I mean, my colleagues right now. So, yeah, the question on the way how to access the printable version is already answered. Perfect. Yeah, and Victoria gave us an update on the multiplier event in Paris, which is transferred to April. So my information is not updated in here. So in April we can meet each other in Paris, and we will specify the date very early on the website. So please check the websites regularly, and you can organize your travel to Paris. Yeah, another question: is there a way how to access materials from the previous Conscious course? Yes, it is available. Zora shared the link to the platform of Conscious One. And you can find, and the access can be given by the national coordinators. So it depends where are you from, and if there is no national coordinator, just select one person who will contact and who you will ask for generating the credentials. Yeah. Sora answered, yeah, and I can see another update of Victoria. So Victoria, thank you. So multiplier event in Paris will be on April 4th. So when I continue in the chat, I can probably find an hour of the beginning of this multiplier event. So as I started with the date, we have with the month. Now we have the exact date, and hopefully we will find the hour. So how can we apply it for the leadership course? Yeah, the leadership part is scheduled for the last 3 weeks of this meeting or of this course. So you can just contact Victoria to give you or to share with you the link to this part. And yeah, Victoria just confirmed. Perfect. And another question: if we wanted to access the Conscious platform, should we use the same credentials? Unfortunately not. You need some other credentials. So you will have some specific ones for the Conscious 2 and specific ones for the Conscious 1 platform. Yeah, and it was the last question in the chat. So once again, thank you for being here. Hopefully you can have a better idea what is the project about, the course about, and what is the organization, general and specific. So next week you will have the lesson on clinical trial designs with Francis from UCC Cork, and the instructions will be sent during Wednesday, so tomorrow. Okay, so thank you for being here. Have a nice rest of the day, and see you in upcoming weeks.